She held the spoon over the bottle, just for a moment, not very long. The baby was crying upstairs. The whole house could hear it. The walls were thin. Most walls were, especially at night. The bottle stood on the table. Brown glass, small label, neat letters. Mrs. Winslow's soothing syrup. It sounded almost kind. That mattered. Some names do most of the work. The mother turned the bottle slightly, maybe to read it again, maybe not. She knew the words. For teething, for pain, for restlessness, for children not settling. It promised relief. Relief is a persuasive word, especially at night, especially when a child keeps crying. Everyone expects the mother to know what to do. The spoon was small. The amount seemed small. That helped too. Small doses make danger look disciplined. She poured carefully. The syrup moved slowly, dark and sweet. It coated the metal. The baby cried again. Someone downstairs shifted. No one said anything. They did not have to. The whole house was waiting, so she carried the spoon upstairs. The nursery was dim. A lamp, a blanket, a damp cloth near the basin, a child hot from crying, a mother tired enough to stop thinking clearly. That part matters. Tired people become practical, and practical things can become dangerous. She lifted the child slightly. The baby resisted, then swallowed. Some syrup touched the lip. She wiped it away. Very gently. Then she waited. The crying softened. The room changed. Not dramatically, just enough. The child breathed more slowly. The mother's shoulders lowered. Downstairs, someone probably noticed the quiet. No one called it strange. They called it working. That is usually how it begins. Not with cruelty, with relief. The bottle was not sold as poison. It was sold as help. It was sold as comfort. It was sold to mothers. That made it harder to doubt, because mothers were supposed to comfort. And this looked like comfort. It came from a pharmacy. It had a label. It had instructions. It had advertisements. It had a woman's name, a motherly name. Mrs. Winslow. That sounded safer than chemistry, safer than opium, safer than morphine, safer than alcohol. A name can soften almost anything, especially when the label is pretty. The advertisements understood the room. They showed peaceful children, smiling mothers, clean clothes, soft faces, the kind of domestic calm everyone wanted. Not the actual night, not the crying, not the wet cloth, not the panic, not the mother standing in the dark, wondering if something was wrong. Advertising rarely shows the room accurately. It shows the room after the product works. That is the trick. The promise arrives already cleaned. Patent medicines were everywhere then, on pharmacy shelves, in newspapers, in household drawers. Many could be bought without a prescription. That made them feel available, and availability often feels like approval. People confuse those things. The bottle was easy to buy, so it seemed acceptable to use. A neighbor may have recommended it. A sister, a nurse, a shopkeeper, a woman at church. Someone with tired eyes. Someone who had already tried it. She might have said, "It helped mine sleep." That sentence could settle a whole argument. Not because it was scientific, because it was human. Parents trust other tired parents. They still do. The mother would not have thought of addiction, or overdose, or regulation. Not in those words. Quote, "Parents, parents, parents." She thought of the child crying. She thought of mourning. She thought of laundry. She thought of her husband needing sleep. She thought of the neighbors hearing. She thought of failing. That word may not have appeared, but it was there, in the room, in the stairwell, in the silence after crying went on too long. A crying child is not just a sound. It becomes a judgment. On the mother, on the household, on the order of things. So the syrup became useful. Useful things are hard to question. The bottle returned to the shelf, or the drawer, or the table near the basin, wherever medicine belonged. It probably stood beside other bottles, cough mixture, castor oil, camphor, liniment, things with sharp smells. Things adults trusted, because adults had always trusted something. The label faced outward, maybe, or maybe it turned slightly toward the wall. Small details like that vanish. History keeps the bottle, not the hand that moved it. The next day continued. Breakfast was prepared. Ash was cleared from the stove. Windows were opened. The baby slept longer than usual. Someone called that a blessing. Maybe it was, at first. That is the uncomfortable part. The syrup did what people wanted. It soothed. It quieted. It slowed the body down. That is not the same as healing. But in a tired household, the difference can become blurry, very blurry. A child stops crying. A mother breathes. The room becomes manageable. The product is trusted again. Nobody needs a theory. The result is enough. Then teething continued. Because children keep growing, and growing is inconvenient. Gums swelled. Faces flushed. Stomachs cramped. Sleep broke apart. The bottle came out again. Not every night. Maybe only when needed. People like that phrase. When needed. It sounds careful. It sounds moral. It lets habit enter politely. One spoonful becomes familiar. The hand learns the motion. The spoon touches the bottle. The child is lifted. The syrup is swallowed. The cloth wipes the mouth. The crying changes. The house exhales. Then someone says, "Poor thing," and the matter feels settled. Some advertisements called soothing syrup a friend to mothers. That phrase did a lot of work. A friend understands. A friend helps. A friend does not require explanation. A friend arrives when the house is tired. The syrup did too. That made it intimate. It did not feel like a drug entering a child's body. It felt like help entering a household. There is a difference, mostly in language. The child might grow quiet quickly. The mother might feel grateful. And gratitude protects dangerous things. Once something has saved you from a difficult night, it becomes harder to see clearly. You remember the relief, not the risk. You remember the silence, not the chemical reason for it. You remember sleeping, finally. The next time, the decision comes faster. This is how routine forms. Not through belief, through repetition. The first time feels like a choice. The second feels like experience. The third feels like common sense. After that, the bottle belongs in the house. It has a place. That matters. Objects with places become normal. A cradle has a place. A blanket has a place. A spoon has a place. A bottle has a place. Once harm has a place, people stop seeing it arrive. It simply waits. On the shelf, in the drawer, behind the basin, near the lamp. There were warnings eventually. There usually are. Doctors argued. Reformers complained. Journalists noticed. Regulators moved slowly. Slowly is a generous word. Children do not wait well for regulation. But households continued, because households move by need, not policy. The baby cries now. The law changes later. That gap can hold a lot of suffering. Some mothers may have noticed something. A child too limp, a strange stillness, a sleep that felt wrong. Maybe they worried. Maybe they asked someone. Maybe they were told it was normal. Babies were fragile. Teething was difficult. Illness was common. Infant death was familiar enough to be explained too quickly. That is another terrible convenience. When suffering is common, new suffering hides inside it. People say, children are delicate. They say, these things happen. They say, at least the poor thing rested. Then they fold the cloth. They empty the basin. They go downstairs. The bottle stays upstairs. No one in the room has to be evil. That makes the story harder. A tired mother is not a villain. A pharmacist is not necessarily a monster. A neighbor is not trying to harm anyone. A doctor may be careless or wrong or simply normal for his time. Normal can do plenty. It does not need hatred. It only needs permission. And the syrup had permission. From packaging, from advertising, from repetition, from exhaustion, from the fact that it worked. In a way, the child became quiet. The house became quiet. The mother was thanked by silence. That is a dangerous kind of reward. The body had been managed, not healed, but managed. And management can look like care, especially inside systems that ask too much of people. Mothers were expected to soothe, to clean, to nurse, to smile, to receive advice, to stay composed, to worry without becoming hysterical, to be tender without becoming weak. A crying child broke the atmosphere. The syrup restored it, for a price nobody could see clearly. After 1906, labels had to become more honest, at least in print. Ingredients became harder to hide. Morphine could not sit as comfortably behind sweetness. The word soothing became less innocent, or less marketable, which is not the same thing. Some shelves changed, some bottles changed, some names changed, but old versions lingered. Old habits often outlive new rules. A mother may still have had a bottle, a shop may still have had stock, a drawer may still have held one, half-used, sticky at the rim, label softened by handling, the spoon nearby, the nursery still upstairs, the child still crying. History likes clean endings. Please, real life rarely provides them. Products vanish unevenly. Beliefs fade unevenly. Fear arrives unevenly. Some people learn quickly. Some learn after harm. Some never know what happened. They only remember the baby slept. That memory can last longer than the warning. Maybe years later, someone found a bottle in a drawer, empty, brown glass catching dust, the label still gentle, the name still calm. Mrs. Winslow's soothing syrup, a little friend for mothers. The phrase sits strangely now, but it probably did not then, not to everyone, not at first glance. That is the part worth keeping, not just the morphine, not just the alcohol, not just the law that came later, the ordinary trust, the soft advertisement, the tired hand, the crying child, the spoon lifted in lamplight, the relief when the room finally quieted. It is easy to judge from a distance. Distance is clean. The room was not. The room had laundry, heat, noise, debt, maybe. Another child sleeping nearby, a husband needing morning work, a mother standing alone, trying to make the night smaller. The bottle helped her do that, and that is why it stayed. Harmful things rarely survive because nobody notices anything. They survive because they solve something, badly, temporarily, at someone else's expense, but enough to be bought again, enough to be recommended, enough to become normal. The child slept. The spoon was rinsed. The lamp was lowered. Someone downstairs stopped listening. Outside, the street went quiet too. Not because anything was better, only because the night had moved on. In the morning, the bottle was still there, near the basin, beside the folded cloth, with a little syrup dried around the mouth, the label facing outward, as if it had done exactly what it promised.